Hello, everyone. I'm Dr. Angela Mattke, and welcome to Ask the Mayo Mom. I'm a pediatrician at Mayo Clinic Children's Center in Rochester, Minnesota, and host of this show about pediatric health topics. February is National Children's Dental Health Month, which is sponsored by the American Dental Association. What many people don't realize is that dental cavities are one of the most common chronic health conditions of childhood. Many of these are preventable, and today we will discuss the importance of dental health and prevention. Joining us for this discussion is Dr. Elise Sarvas, who is a board-certified pediatric dentist and provides hospital-based pediatric oral health care at Mayo Clinic Children's Center. She received her dental degree from the Adams School of Dentistry at the University of North Carolina at Chapel Hill and did her residency, master's in pediatric dentistry, and master's of public health at the University of Seattle and Seattle Children's Hospital. Dr. Sarvas specializes in oral health of children, infants, adolescents, and persons with special healthcare needs. So if you're listening to us live today, we want to hear from you. So please send in your questions and we'll do our best to try to answer them during our live broadcast. Dr. Sarvas, thank you so much for joining us today.
Thank you so much for having me and for kicking off National Children's Dental Health Month.
Yay! On February 1st, no less. We're here to make sure that we're raising awareness because, like you and I both know already, that there are a lot of children that have dental cavities or maybe don't have access to dental health care. So we really want to raise awareness of it so people know that this is something that they should be doing, just like going to see their pediatrician and getting immunizations and all those different things.
Exactly. So thanks so much for having me. Everyone has teeth. And so I like to talk about teeth because it's something that we all can relate to.
Yeah, absolutely. So why don't we start with talking about what are the basics of dental health in children?
Yeah. So babies typically are not born with teeth. Occasionally they are. And if they are, that's an issue that a pediatric dentist can help with. But we end up having about 20 baby teeth. And then as we age, we get a set of adult teeth. So humans are called diphyodonts. And that's one of my favorite pop trivia questions.
What are they called?
Diphyodonts, which means that we get two set of teeth, unlike sharks, which get lots and lots of set of teeth. So those first teeth start popping in around age 6 months, and we finish getting our baby teeth at around 2 to 2.5 years. And then the adult sets start coming in around 6, 6.5, and then we usually finish around age 12 or 13.
Okay. And so one common question that I hear all the time is, when should parents start brushing their teeth? With what? How often? Kind of all those details.
Great question. So we should start brushing teeth as soon as we see them. This can help disrupt some of the bacteria that cause dental cavities. It takes it off. It also takes off food that might stick to teeth. We recommend seeing a dentist by the child's first birthday or first tooth, whichever comes first. And that first visit is going to be a lot of talking and a little bit of looking, but a lot of talking, just so we can help you if brushing is difficult, if your child is a little wiggly and it's kind of hard to get a toothbrush in there. We recommend brushing with a fluoridated toothpaste. And for that first kid, those first few years, we want to make sure they're not swallowing too much of that toothpaste. So we use about a rice size amount. And I have a picture that I think might be helpful for viewers. I'm a visual person, so I really like to see a visual. And so you can see this rice size grain amount here. I really like to take the toothpaste tube and then just kind of scoop out a little tiny bit. So that way I'm not putting a ton on there. This amount is safe to use for all ages and all teeth. And then as kids are able to spit better and have a little bit more mouth control, we'll switch to a pea-size amount that you can see here on the right.
There's a lot of training toothpaste, and I just want to make sure that we delineate kind of the difference between them, because I think it's hard for parents to know which one has fluoride and which one is the one that doesn't have fluoride in it.
Great question. And so I like to treat fluoride as a medicine because it does help to strengthen teeth. It also prevents the demineralization, so it makes it harder for cavities to form. But you want to treat it like a medicine so the kids aren't swallowing lots of it. So any toothpaste that says it has fluoride in it, we'll say it really clearly labeled on the tube, and it will have the seal of the American Dental Association. And so those are toothpaste that I would say parents can use especially for their younger kids. If a kid is really independent, mine loves to put her own spoon in her mouth. Now, does it get in her mouth? No. Is it everywhere else? Yes. If they want to kind of do that and practice with toothpaste, a training toothpaste that doesn't have fluoride is great for that practicing. But we know from studies that brushing alone without fluoride won't actually prevent cavities. So we do need that fluoride in there.
Awesome. You brought up a really good point of the actual practicality of trying to brush a kid's teeth and they get to like 18 months and everything is independent. They don't want any help. What tips do you have to try and get your kids' teeth brushed, and how long should you brush for?
That's a great question. I used to tell families that kids can brush independently once the child started learning cursive. It does take a lot of manual
Oh, cursive.
dexterity,
What if they
but
don't
that
teach cursive anymore?
but they don't teach cursive anymore. And so it's really challenging. So I would say when a kid is able to tie their shoes, they
Okay.
probably have the manual dexterity to get into all those nooks and crannies.
Mhm.
So for kids who are independent, and we love independence, it's building hand skills, it's building, self-confidence. I say have the child brush and get all those things, and then the parent go back and check. And then I knowingly glance to the parent and I say, and by check I mean actually like, do it.
Yeah.
Because sometimes kids are really good at getting the front ones and not so much the back.
Yeah.
But a good way to check is if there's any small little areas with bleeding, just
Mhm.
go back and brush a little bit more. That's a sign of inflammation. And if you brush in that area consistently for a few days, that little bit of bleeding will go away.
Okay, sounds good. Can kids brush too much? Because I get that question a lot, because there are some really diligent kids that like want to brush their teeth all day long too. Is that a concern?
We don't want them to wear away their gums. And
Okay.
so if you're consistently brushing one with a soft toothbrush, the softest you can find, I like to run it under hot water to kind of
Mhm.
loosen up the nylon bristles, as well as just brushing for 2 minutes twice a day. That's what our recommendation is. So don't have them go scrubbing everything, but just gentle brushing around those areas will be helpful.
Okay. I want to circle back to the fluoride, because you talked about how important it is for cavity prevention. And at dental offices, they often apply fluoride varnish. And at pediatric like healthcare offices where kids get their primary care, we've started applying fluoride varnish as well at well child visits. So why is fluoride important? Because I know that there are some misconceptions out there about fluoride as well.
Oh, sure. Fluoride is a naturally occurring element. It happens naturally in nature, and some areas have lots of water fluoridation in their natural water supply. Some it's added to the community water supply. Here in Minnesota, it's added to the community water supply. If you
Mhm.
don't know, you can always get it tested or check with your county to see if your water's fluoridated. But we add fluoride to things like toothpaste, and you get it at your pediatrician or your dental office because it can make the outer surface of the tooth much stronger and resistant to decay. So it actually replaces the very, very edges of our teeth with a harder mineral than what we're naturally born with. And that can help prevent cavities. It's actually the best thing we know to prevent cavities and our best public health measure.
Yeah, yeah, it absolutely is. How often should children be getting fluoride varnish, and when would you recommend it be started?
That's a great question. So one of the things is we want to look at what the risk of getting a cavity is. If your risk
Perfect.
of getting a cavity is
Mhm.
higher, we want to apply it more often. So just to
Mhm.
give your teeth that fighting chance. It just also depends on the child's diet, how brushing's going, and all those other things. And so we really recommend seeing that dentist by the age 1 visit to kind of work through the list of things that tell us like if your child is at higher risk of having a cavity or not.
Awesome. Now, are there any like downsides? Can you do too much fluoride? Is that can be a problem for their health at all?
It's less likely if you're getting it applied professionally by a dentist or a doctor. If you're getting it from both sources, from both your pediatrician and your
Mhm.
dentist, I would just communicate that with them, and they can help you decide, has the interval been too long, or if not
Mhm.
long enough, or is it beneficial? Sometimes I see kids and they've just been to their pediatrician that morning and had fluoride, and really there's no benefit for me adding more at that
Mhm.
point. So just
Mhm.
communicate that with your dentist and doctor.
Yeah, absolutely. I love that. One of the things I can just add in as a pediatrician is like, if I would prefer they get it at their dental office, because that means that they're getting all their other dental checks, they're looking at their teeth and doing like their full preventive healthcare, just like they did at my visit. But if they don't have a dentist or haven't seen him yet, I feel like that's the opportunity where we can kind of bridge until they can get established with preventive dental health.
Oh,
So
exactly. We love that you all are providing fluoride too.
yeah, I'm interested to see if we can kind of chip away at dental caries
Yes.
in children over the years, because this is kind of something new that we've started about 5 years ago across the United States. So, you mentioned that risk factors predict how often kids should get it. What are some risk factors for dental cavities?
Right. So we know that cavities are caused by bacteria and sugar. And so it just depends on exactly how much sugar a child might have in their diet. And sugar comes in some really like sneaky forms. So my my least favorite form of sugar is actually goldfish crackers, because everyone Everyone thinks that they're goldfish
I
crackers.
had
They're made
no
of
idea.
yeah, they actually stick to teeth really well. So next time you
Mhm,
have some crackers, just kind of take a look at what your teeth feel like.
mhm.
I traditionally thought of sweets as like, gummies and candies and things like that, but really any fermentable carbohydrates, so carbs that can break down into sugar can also cause cavities. We also know the bacteria in the mouth. So if you're unable to brush really well and get that bacteria off of the teeth, that can increase your risk of getting a cavity as well.
Okay, sounds good. Now, we kind of talked about this earlier. Not all children have access to dental care. What can families do to kind of find a dentist or see if they can get insurance coverage for dental health?
Fortunately, under the Affordable Care Act, pediatric oral health was included as one of the 10 essential benefits. So at first I would, yeah, I know, yeah, I was so excited. There's still some, areas to be worked out there, but a lot of
Mhm.
times I have families call the back of their insurance card to find a dentist. Kids can be seen by general dentists, family dentists. They can also be seen by pediatric dentists. The difference is that general dentists take care of the entire family. They're really great, really accessible. Pediatric dentists might be someone for your child if they are a little bit scared of going to the dentist, if they have a medical complexity, or if you would just feel more comfortable with someone who specializes just in kids. But general dentists are wonderful. It's establishing those great oral health habits too. And pediatric dentists do an extra 2 to 3 years of training after dental school. But if you're going to your family dentist, I would ask them if they're able to see kids.
And they get a whole bunch of master's degrees too, like you did.
Yeah, I think we're all tooth nerds in a way, and so sometimes you get to like study it just a little bit more in depth.
Awesome. So we talked about sealants. Another thing that is really, I think, important for preventing cavities is sealants. Okay.
Yes.
So what are they? What are they recommended? Who are they recommended for?
Great question. I'm going to share my screen again because I love a good picture. So here on the left, you can see a tooth that has really deep grooves. You can probably feel those with your tongue in the back of your own mouth. Those grooves are great at trapping bacteria and food particles and getting cavities to kind of form in those deep areas. Sometimes a toothbrush can't quite clean all of those. The bristle is just not big enough. And so what we can do is place a little protective coating called a sealant. On this right-hand side, you can see the white colored sealants here. Sealants come in white colored or clear colored. I've had kids ask for pink ones before, but then it kind of looks like pink gummy stuff is stuck in your back teeth.
Yeah.
But they can prevent the bacteria from coalescing in those grooves and food from getting trapped. We also know that if you have the very beginnings of a cavity, so in this left side, you can see that very beginning of a cavity, if we seal it off from the oral environment, we can entomb that bacteria. And so it stops forming that cavity. So you can almost stop one in its tracks, which is great.
Wow.
If you think you're like, I don't know if my kid should have sealants or not, my favorite test is called the Oreo test. So buy some Oreos. I mean, you can eat all the rest of them. Have your kid eat the Oreos and then check their mouth 20 minutes later. Some kids are really good at cleaning out their own grooves with their tongue, or they just don't like that feeling in their teeth and so can self-groom. But if you see that your kid still has black areas, that can tell you that food is still sticking around for a long time and it might be time to get sealants.
Okay, excellent. Is there like a time frame where sealants would be considered?
Usually for teeth that have grooves. And so we're getting those back molars around age 6 to 7. We need to keep this teeth really dry when we place the sealant so it sticks to the tooth better. And so sometimes we're just waiting for that tooth to come in a little bit more to be able to keep it dry with different instruments in the office.
Gotcha. Another question that I have heard is, are these safe as well as you're putting something like on the tooth?
Yes. So they are made of the same dental material that you would get a white colored filling with. Yeah. So it's just stuff that we're normally using. Some sealants release a little bit of fluoride to help in those areas, but they come in different flavors, really. They don't taste anything, but they're just different kinds. And you can ask your dentist what type they are using.
Okay. Another fundamental thing that you do as part of dental care is to get dental X-rays. do children get their first dental X-rays, and why do you do them? I guess helping me understand that.
Of course. So I always say my superpower would be X-ray vision, right? It wouldn't be fly, it wouldn't be any of those other things. I need to see in between teeth, because if we can see in between teeth, we can see if cavities are forming. And I'm going to share another little photo here. So this is a kiddo. I really wish I had X-ray vision because that would
I
help me a
bet.
lot. Sometimes cavities form in between teeth, and sometimes we don't see those until they're too late. So this is a kid, teeth look amazing. Everything looks really great. And then we ended up taking some X-rays, and you can see hiding underneath the surface are these little darker areas. And those little darker areas are cavities. And we didn't know that they were there until we took those films. Once we're able to see those, then we can fix them earlier, which means we can do a smaller filling, a filling that'll last longer, and hopefully save that tooth from needing to be taken out or extracted.
Excellent.
Yeah.
We have a great audience question here that I wanted to throw in. What if a child had poor dental health in childhood? Can that same trajectory carry on into adulthood, even if they're receiving preventive dental care?
That is a great question. So we do know that the best predictor of future cavities is if you've had cavities in the past.
Okay.
So ideally, we would like to take care of all the oral health of kids and to set them up for a healthy adulthood. But that's okay. If that wasn't the case, we can still do things. So we know that we can modify a lot of the risk factors for cavities, including diet and learning about different carbohydrates, right? We thought that goldfish were healthy because, they're baked and they're made with cheese, but they actually contain a lot of carbs. And then also making sure that those new adult teeth get adequate fluoride and that you're learning to brush properly. It's not set in stone that, for my grandparents, they all ended up with dentures. And I thought growing up that that's what everyone did. But my favorite part of my job is you can kind of change that future. And so, yes, we do know that changing habits is really powerful, and dentists are here to help you with those.
The adding fluoride to the drinking water really dramatically decreased cavities. But there are a lot of children in the United States that get their drinking water from wells. And so sometimes there's fluoride supplementation started for children that get their fluoride from wells. Can you talk a little bit about that, when that would be indicated?
Yes, I would recommend testing the well water first to see if there's fluoride. Fluoride is naturally occurring. So we know in some areas, like in Colorado, they have really high levels of fluoride in their water. Other parts of the world, like Kenya, have 10 times the amount that we recommend. So yeah, we actually recommend maybe like distilling water in those areas. So first test the water. If there's no fluoride, or if it's not quite to the level, which is in the United States, 0.7 parts per million, so like even less than 1 part per million, then we would recommend a fluoride supplementation. And so that could be in a couple of different ways. We could either write a prescription for that, or we can make sure you're just getting more frequent applications of that fluoride varnish. Again, it depends on the risk of getting a cavity, and that's on an individual basis for everyone.
Perfect. There's something called nursery water that sometimes parents will use to prepare formula if their drinking water doesn't have it. Why do we use nursery water?
Yeah, great question. My kiddo, my 7-month-old, she's a bottle baby. So we've given her formula since the day she was born. So what I didn't know until I became a dentist is that formula, that powdered formula, has fluoride in it. And so we want to make sure that we are adding distilled water, so water that doesn't have fluoride in it, so that it doesn't give the child too much fluoride, because even though she doesn't have any teeth, her adult teeth are down below the gums developing, and we don't want to risk a condition called fluorosis. Really mild fluorosis has little white spots on the teeth. You might have noticed on your friends or family or even yourself, but that's fine. We just don't want it to go into moderate fluorosis, which can cause brown spots or like slightly weaker areas of the tooth. And so you want to look for nursery water that's either been distilled or purified via reverse osmosis.
Okay, excellent. All right, we're towards the end of our time, so I saved braces for last. My oldest is in braces already. So it's something that a lot of children and teens may need. Why do some children need braces and other teens don't?
Yeah, great question. So for braces, we recommend children, and the American Association of Orthodontics recommends kids getting screened by age 7. Sometimes their teeth won't quite fit together, and there'll be what's called a crossbite. So one part of the teeth is over. If that continues into adulthood, that affects how the jaw will grow, and that can have some TMJ issues in the future, that temporomandibular joint that we use for chewing. It also has some other implications for facial development and symmetry. We like to see kids early for braces so that we can harness some of their growth patterns. And maybe we just do like a interceptive ortho, which is just braces when they have some baby teeth left to modify that growth, and maybe they won't need adult braces when they're adults or in their teenage years. Sometimes kids still need adults braces when they're in their teenage years or in their adult years, and we can help with that, and that helps line teeth up so it's easier to floss in between, it's easier to clean, and aesthetically it feels more appealing, especially as kids are developing their psychosocial awareness in those teenage years.
Yeah, definitely. But having the braces probably limits your ability to really get the teeth clean in some ways. So what are some tips that you can give for people that have braces to help really do good dental hygiene?
Yeah, if you know you're getting braces, now is a great time to start practicing flossing if you haven't been doing that before, because flossing with braces is much more difficult. And so if you're good at it already, it's going to make that transition easier. I would say, you're going to visit your orthodontist a lot of like every 6 weeks, maybe sometimes even more frequently if brackets are popping off. But you want to make sure you're still visiting your dental home or the dentist you normally see for cleanups, cleanings and checkups and things like that. You want to make sure you're getting adequate fluoride. I like to tell my friends who are in braces, after you brush, you can spit once, but don't rinse with water. That'll let the fluoride in the toothpaste kind of soak in around those teeth and just give them a little extra boost to prevent some cavities forming around them.
Okay. What about water picks? I know that that is kind of like not something that was around when I was a kid. We had not even the fancy little picks that they have now. Are these helpful, or are these something that children with braces could consider using or not?
Yeah, the studies show that it's not more effective than floss, but if you're not going to floss, it's definitely more effective than not flossing.
Okay. So there's a hierarchy.
Yes. Yeah.
Okay.
It definitely will power wash, that's what it kind of describes, like power wash all the food that gets stuck in those braces, especially if you have something in the top of your mouth, like a retainer. I tell families maybe use it in the shower because it's very messy as well.
Oh, that's a really good idea. I'm going to have my son do that because our mirror is just.
Is your mirror just disgusting? Yeah.
Yeah. It's disgusting. So we're going to move that to the bathroom shower. So
yeah, if the cord will reach, it's it's a game changer.
Yeah, it's absolutely. All right. Well, we've reached the end of our time. Do you have any parting thoughts or comments things you want to highlight?
Yeah, I would just say, if you're listening to this and you have a 3-year-old who's never been to the dentist, it's never too late. We recommend that age 1 visit, but we do recognize that lots of things are going on in those first few years. So, partner with your dentist and partner with your pediatricians. If you're unable to find a dental home, they might be able to help guide you to somewhere. And be well. Thank you so much for letting me be on here and kick off this wonderful month.
Thank you so much for joining us, Dr. Sarvas. And thank you everyone who listened and sent in questions. Have a wonderful day. Stay safe. Update your vaccinations for COVID and influenza. Bye-bye.